Some 51 million people live in rural communities across America. That's nearly 20% of the population of the United States. The millions of people who live in rural communities depend on their local hospital as an important care provider, employer, and community partner. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, senior writer for AHA. Historically, AHA has used our robust membership, policy expertise, and mission to advocate for policies and influence the political process in real time to advance the health of communities. More recently, the AHA Board of Trustees identified the need for the association to build out our expertise in longer-term strategic policy planning to complement the work of our near-term policy agenda. One of the top priorities identified for this new portfolio of work is the future of rural health care. With 118 rural hospital closures since 2010, rural health care has become a hot-button issue in the media and among policymakers, legislators, and the administration. To develop actionable solutions, the AHA launched the Future of Rural Healthcare Task Force earlier this year, in July. The task force is charged with developing bold, new ideas to create sustainable care delivery and financing models for the future. AHA recognizes the need to identify sustainable models that ensure local access, in addition to the important advocacy efforts to address the challenges of today. The chair of the task force is Kris Doody, CEO of Cary Medical Center in Caribou, Maine, a nurse by training and a former AHA Board of Trustees member. Let's join Joy and Kris.
I'm Joy Lewis, Vice President of Strategic Policy at the AHA. Kris, thanks so much for joining me on Advancing Health.
Absolutely, and thank you so much, Joy.
So we're 3 months into the Future of Rural Healthcare Task Force. Can you share your experience on the task force and what you hope to accomplish?
Absolutely. Thank you, Joy. And we have assembled a great group. First, I want to acknowledge the diverse membership of this task force because it's so important to recognize that not all rural communities are the same, and there can be some very unique challenges in an individual area. But the care taken to make sure this group is full of big ideas and is representative across our rural setting creates that strong foundation for our success, and I think we've just assembled a great group. We have task force members from North Dakota to East Texas, from Alabama to Oregon, and of course, way up where I live, way up near the Canadian border in northern Maine. We have administrators, we have nurses, physicians, and more. The diversity of the location, the diversity of the professional experience, and the lived experience will ensure that we craft solutions that can accomplish the nuances of our many communities and celebrate our very unique qualities. We've had 2 meetings so far, and I know we have a very passionate and talented group assembled. I so look forward to this opportunity to harness the leadership of this group and to think the big, bold ideas that we have so far and think differently. We have to think differently to create solutions that will help us ensure local access to care for our rural communities across this nation.
Awesome. Let's go a little bit deeper, Kris, into the challenges that we know our rural healthcare organizations are facing. They've really got a unique set of challenges, most notably providing care in geographically isolated areas with low patient volumes and a real high reliance on government-funded coverage. Can you just share with our audience a bit more about what you and your team at Cary Medical Center are doing to navigate these challenges?
Absolutely. You talk about geographically isolated. So my hospital is located in the largest county east of the Mississippi. Believe it or not, my county is the size of Connecticut and Rhode Island combined. It's about 6,200 square miles, but it only has a population of 70,000 people in our county. So you can see it's a lot of land mass and people to take care of. And one of the things that we've done as an organization over the years is to expand and develop relationships because we very early on discovered we can't be all things to all people. And there's a lot of resources available within our community, within our county, that we have to have these strong, unique relationships to stay strong. And one of those relationships that is rather unique is a relationship that our hospital has with a local physician practice, which is primarily an FQHC, a federally qualified health center. And we came together years ago to address some of the healthcare needs of our community in the 7 communities that we serve in our county, and to ensure that we have access within some of these very rural communities within this large county. We recruit physicians together. We conduct strategic planning sessions together focused on our community. We share staff. We actually have contracts between the 2 organizations and share staff. We actually, over the last few years, have combined 2 small billing departments into one large billing department. So the Pines Health Services, or the FQHC, contracts for billing services from the hospital. It's a lot more efficient. There's increased cross-training. There's less turnover. We've integrated our electronic medical records. And in the future, we're looking at combining more services such as payroll, plant engineering. We've even talked about looking at a brand new medical office building right here on our campus at the hospital for the FQHC.
That's awesome. You've got a whole lot going on, Kris.
Yeah, we do. You have to for the community.
Exactly. From our task force meetings and my conversations with members, I've been doing some one-on-ones. When we talk about challenges in rural settings, we inevitably end up talking about the workforce.
Absolutely.
They're a major concern to you and your colleagues. What do you think are the biggest opportunities to address workforce challenges, particularly in rural communities?
Yeah, as I mentioned earlier, it's, again, about relationships and collaborations. We have to get creative. We have to use the strengths in these relationships and collaborations to craft really some coordinated solutions. To give you another example of what our hospital is doing, we actually partner with Maine Medical Center and Tufts University, and we began what's called a 9-month integrated longitudinal clerkship. It's a 9-month rural rotation for third-year medical students to actually come to our community and be exposed to rural health care. We've had 3 cohorts. We have 2 students at a time, and we've actually had 3 cohorts serve in our community. They actually become part of the community. They engage in community events. They become part of our medical staff. They visit our patients. They round on patients in our hospital, and we stay engaged with them. We want them to grow and understand rural health care because many of our physicians obviously go on to rural health care to practice. Well, since the cohorts have gone through our hospital, we have stayed engaged with them during their residency. And the very first 2 students that we had from Tufts Medical who rotated through our facility are now in residency, one in family practice and one in internal medicine. And we've actually made them offers to come back to Caribou upon the completion of residency and or their fellowship to actually join the workforce and become doctors at our facility. And it's because of this collaboration and relationship with Tufts Medical that we can make that possible. We also work very closely with higher education, the university system, the community college system, to increase the number of nursing slots, nursing education slots in a given year. We're predicting the nursing shortage in our states is pretty high, and we're very concerned about that. But again, working in collaboration with higher education and having these strong relationships, we're able to increase the number of nursing graduates. I've actually offered some of our experienced nurses to serve as instructors and preceptors in the nursing programs right here in our county so we can ensure that we have enough nursing workforce going forward.
From my work with all the task force members, I happen to know that rural hospitals are already engaged in innovative practices daily. We've heard examples of telehealth integration, creative community partnerships, and so many more. Can you talk about the role that innovation plays in rural communities?
Yeah, I sure can. From our very first meeting of the task force, our very first exercise, we actually went around the room and shared some very innovative ideas that were happening in some of our task force hospitals. And the ideas and the stories were amazing. It really gave us that first glimpse into innovative ideas that are happening right now in our rural hospitals across this nation. And one of our members in particular, and an AHA board member, Greg Polson, shared his system at Intermountain and how they've integrated telehealth at every bedside. This has allowed them to use expertise of the specialists for consultation and provide perspective. It has expanded their team-based approach to care and use of resources strategically to support patient care. I mean, just so innovative. We also heard from another task force member and an incoming board member to AHA, Dr. Roxy Wells, about her partnership with a local community college, I mean, similar to what I described earlier, to help build a nurse pipeline. Many of us face these challenges with recruiting staff in rural areas, and her partnership with the community college showed how you can grow the talent in your own community with the resources that you have. Her hospital helped provide funding for a new instructor to increase capacity and provided scholarships for students who agreed to work for the hospital after finishing school. And for many of these students, it may be their second or third career. These innovative solutions extend well beyond the hospital. Now you have individuals in the community who are given an opportunity to build their skills, their experience, their education level, and more so, stay local in your rural community. This provides more economic opportunity and stability for individuals in their community. And I know there's many, many more examples of rural innovation out there.
It is always amazing to hear innovation is happening directly from our healthcare leaders like you, Kris. So through the task force, you've gotten to meet and work with new rural colleagues and dedicate more time to long-range strategic thinking around rural health. Would you like sharing with our audience what's really inspired you over the last few months of working with your task force colleagues?
Oh, absolutely. I'm honored to share how inspirational they've been to me, and I'm sure to other members of the task force, because we have some very, very talented and innovative rural leaders that are on the task force. They've taken risk in their own community by trying some new, bold ideas. Some of their ideas have worked the way they planned, and some they've had to modify. But I can tell you what has inspired me is that talent and the ideas from this task force. They have taken on some challenges and have partnered with their communities, with the relationships that they've developed with other organizations to make a difference for their rural community. And with this increased attention right now on rural health care and its future, I envision that members of the task force will have a voice, whether it's through presentations, build talking points for advocacy, serve as guest speakers, or share some of these bold ideas that can be replicated in other parts of this country in rural areas. Even though we're just getting started, we've only had a few meetings, the energy of this task force is contagious. We've connected at our very first meeting, and we all have a passion for the work that we're doing in our rural communities. So I think we're going to have a lot to offer and a lot to share with our colleagues.
Thank you so much, Kris, for joining us today on Advancing Health.
Thank you, Joy.
You've been listening to Kris Doody, CEO of Cary Medical Center in Caribou, Maine, and Joy Lewis, Vice President of Strategic Policy at AHA. We look forward to the policy solutions coming out of the Future of Rural Healthcare Task Force. This has been Advancing Health, a podcast from the American Hospital Association. Thanks for joining us.